When we're talking about hyperextension, this is when the knee joint is actually going to bend the opposite direction and it's going to go well beyond that 0 degrees. In tonight's Game 4 matchup between the Atlanta Hawks and Milwaukee Bucks, we saw Giannis go down with a horrific looking knee injury, and this is a knee injury that absolutely could have major playoff implications. Now, on the actual play that we saw Giannis get injured on, he was coming down from a jump, and as he was doing this, a player actually made contact with his leg around the knee area, and we saw what looked like his leg actually bend back in the opposite direction. Now, as of right now, we don't know the extent of Giannis's knee injury, but this injury was, of course, bad enough because he did stay briefly on the bench, but he did head to the locker room before the Milwaukee Bucks ultimately ruled him out for the remainder of the game. The specific position that Giannis's knee actually went to is clinically known as hyperextension, and since some people may not be too familiar with why hyperextension is such a dangerous position for the knee, I'm going to go ahead and focus on that with this video. Welcome, basketball fans. For those of you that aren't familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. With this video, we're going to take a very close look at Giannis's knee injury that he suffered tonight in the Game 4 playoff matchup between the Atlanta Hawks and the Milwaukee Bucks. If you like today's video and you find it informative, please hit that thumbs up and subscribe to the channel because I will be making more videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you have any comments or questions, please leave those in the comment section below. Now, on the actual play that we see Giannis get injured on, we see right here, he is jumping up and he's coming on down, and as he lands, a player actually makes contact with that left knee, and this is going to push that knee into a motion known as hyperextension. Now, here I have a model of the knee joint itself. And so the knee joint is made up of, we have the femur bone, which is in the thigh. That's going to come on down and form that top portion of the knee. And then in the bottom portion of the knee, we actually have the tibia, which is the bone often associated with as the shin bone. And right directly to the outside or lateral portion of that, we have the fibula bone. Now, the knee joint is a specific type of joint known as a hinge joint. And a hinge joint, essentially what's going on here is this is going to allow the leg to bend and extend. So it has two major motions that are at the knee, and it's going to have very minimal side-to-side movement. Now, a person goes into flexion when the knee is bending like this. Now, when a person is going and straightening the knee, this is known as extension. Now, there is a normal value for extension, and the textbook value for that is 0 degrees, essentially meaning that the person's leg should be in a straight line when it is at maximal extension. I will say, in terms of my personal practice experience, I've seen people with a little bit of hyperextension at the knee joint, so that seems to be normal for some people, but generally speaking, maximal extension is when that joint reaches 0 degrees and forms a straight line. Now that we know the two main motions of the knee joint being flexion and extension, I'll go into what exactly hyperextension is. Essentially, when we say hyper in terms of anatomy, this means that it's going to go way beyond the normal value. So when we're talking about hyperextension, this is when the knee joint is actually going to bend the opposite direction and it's going to go well beyond that 0 degrees. Now, we have 4 major ligaments that are located within the knee joint that contribute to overall knee stability. And they are, of course, the anterior cruciate ligament, or the ACL for short, located here. Then as we go to the medial or inside portion of the model here, this is the medial collateral ligament, or MCL for short. Now we go to the outside or the lateral portion, and this is going to be the lateral collateral ligament, or the LCL for short. Finally, as we move on to the back here, this is a ligament known as the posterior cruciate ligament, or the PCL for short. Then, of course, there is the medial and lateral meniscus. These are two important structures that are located within the knee joint. Without these two structures, you're going to have bone-on-bone friction. Now, let's go ahead and we'll go into why hyperextension is such a risky position for the knee. Now, when a person goes into hyperextension or beyond that 0 degrees, you can see on this model here that as I take it beyond that into that range of motion, all of the major ligaments in the knee are visually taut. And this is because When a person is going into hyperextension, they're going beyond their normal range of motion, and it is essentially stretching or stressing all of the major ligaments in the knee joint. Now, some other structures that can be implicated in a hyperextended knee, of course, are the medial and lateral meniscus. And as you see in the model here, if a person goes into enough of that hyperextension, you can see that both of those structures actually are getting pinched in the front of the knee there. And finally, on the knee joint, you have something known as articular cartilage, which is located on both of the femur and the tibia bones. And as you can see here, if it gets pinched enough, those also can be implicated in this type of an injury. So as of right now, we don't know officially what is going on with Giannis's knee, but it is very important to know what could potentially be affected in this type of a position for this injury. Now, I know what a lot of people are going to ask. They're going to ask whether or not I feel like Giannis has an ACL tear or something serious along those lines. The truth of the matter is we don't know until he has the gold standard, which of course is the MRI. So I expect him to have that relatively soon, and hopefully we know the results of that. But there is a very good on-field or on-court test that can be done, and this is known as a Lockman's test. Essentially, when a person is doing the Lockman's test, what they're going to do is they're going to stabilize the person's femur, and they're going to pull on that person's tibia. And basically they're doing this because the ACL functions to prevent that anterior movement or anterior translation of that tibia. So essentially what the examiner is doing is they are doing this to see if a person has excessive motion compared to the non-injured side. So when a person does this Lockman's test, it's really of utmost importance to do it on the injured and uninjured side to determine whether or not that person has knee laxity. But once again, despite having some laxity in that Lockman's test, it's going to be really important that he has that MRI. So I'm not going to base a decision right now based on what I observed, because it's very possible that he does not have any ligament tears at all, and it is just going to be diagnosed as something known as just a knee hyperextension. So I'm going to wait and see what is going to come out in the news. Hopefully we'll get an update fairly soon. And once I get an update, I'll be sure to update everybody in the comment section. And that's it as of right now regarding Giannis's left knee injury that we saw happen tonight in their Game 4 matchup against the Atlanta Hawks. Once again, thank you very much for watching. I really appreciate it. If you like today's content, please subscribe to the channel because I will be making more videos in the future. Thanks for tuning in, and I'll see you next time.